com a Kelly.
Bom, deixa eu ver aqui, vamos só ver aqui os participantes. Breno, já conheço.
So, Breno, I already know him. Catalina Cíntia, Gilberto Benítez, I also know him. Oranco Nov, Heloísa, Kai Huang,
Reno Kunz,
Reno Kunz,
Maripaz,
Maripaz, Sebastián Erico.
Welcome everybody. It's a pleasure being here with you. We were supposed to have translation in Portuguese, English, and Spanish. But
A Kelly está entrando, doutor, com espanhol, tá?
The Spanish translator is coming in. El traductor de español está llegando a la reunión. Entonces, si quieren escuchar en español.
So if you want to listen to Spanish, just 1 second. She's going to join us here.
No hay problema, se entiende perfectamente.
We can understand really well.
Perfecto, sí.
Sebastián, ¿de dónde eres, Sebastián?
Where are you from, Sebastián?
Argentina.
I'm from Argentina, from the city of Córdoba. Great.
Muy bien. Entonces vamos.
All right then. Let's start then. I'm Dr. Luis Fernando and I, we're coordinating here.
Give some advice to you if you want to listen in English. For those who speak in English, it's possible to activate the translation. You will find 3 dots in the bottom of the screen, and you can select, there is a globe or the 3 dots, and inside the globe you can choose your language, Spanish, Portuguese, or English. And we can talk in our own language. Okay? Did everybody find the globe and find the translation, the simultaneous translation? Yes? Guran, Kei Huang, Reno,
Mr. Catalines, Anu, please, can you close your mic? Thank you.
Só vamos silenciar pouquinho aí o microfone, né?
Now, yes, let's turn off our mics. Okay, now they're all closed. So the goal of this meeting is to clear up any questions that you might have about the course. We've had this course for over 11 years. We give it here in Brazil. It's an official course of the Brazilian Society of Mastology, and it's a great opportunity for everyone who are interested in the breast reconstruction. It is a unique course because it's very thorough, very big one, and during the course we operate on over 100 patients. So there is a lot of information, different courses. The amount, the price, it might be a bit higher than the other courses, but if you compare to other courses, the number of classes and the number of surgeries also that are encompassed are much smaller. In each meeting, you just operate on 1 or 2 or 3 patients. Here, in each one of the meetings, in our course, we operate on 9 or 10 patients. So it's a course that is much broader. There is simultaneous interpretation, the debaters from many different countries. So it's a very large structure, which shows the complexity of this course. So it's not the same thing doing one course like the one that we have and the course in the competition. Our course, the students that graduate from our course, they have a lot more information, a lot more training to do the breast reconstruction surgery. I had already prepared a very short presentation of 15 minutes, 10 to 15 minutes, about the course, about how it works. I think it's interesting, especially for people who are interested. They're not really sure if they're going to join the course. I'll open the presentation now. Now I'll share my screen with you. It's important to mention also, Dr. Hedges, about the WhatsApp group and how close they are to you with Dr. Luis as well. The course is more of a mentorship than a regular course, right? During the course, the amount of students is limited, so everyone can take part actively. They can open the mic, discuss personal cases. We have a WhatsApp group of discussion of cases, and I'll explain how it works, how the structure of the work is. Probably in the presentation, it's going to be more detailed. So there are a lot of unique aspects. Can you see the screen? This is an official course. No, so you cannot see my screen. No, you haven't shared yet, doctor. Okay, we just can only see you. All right then. 1 second. Yes. Okay. Great. As I mentioned before, this is an official course of the Cancer Hospital and the Brazilian Society of Mastology. Oncoplasty nowadays has a lot of is in a very privileged position. We have a lot of people that are interested in breast reconstruction. We published this paper a few years ago, showing in the past 35 years the amount of times that the word oncoplasty has come up in medical literature. So we can see that there was an exponential increase. A lot of people are interested. They are publishing. And Brazil is an intermediate group of publications about breast reconstruction. The word oncoplasty, it's basically the oncological treatment associated with plastic surgery techniques. It started with Dr. Werner Aldrich, and I had the opportunity to go there. Dr. Krishna Plosson, they are personal friends of mine. We worked together and we studied together. It was created for the partial reconstruction of the breast. But nowadays we use oncoplasty, especially for full oncoplasty, not just partial. I still like separating oncoplasty and partial reconstruction, and the full breast reconstruction with an implant, with autologous flaps. From the very beginning, in the early 80s, Dr. Mauricio Nava, another pioneer in this field, mastology. All of these doctors were mastologists, the pioneers in this area. Oncoplasty. Dr. Mauricio Nava is a plastic surgeon and a mastology, a breast surgeon from Italy. In the 80s, he used to say that he talked about the vertical surgeon, which is a surgeon that has a mastery of both the oncological aspects and the reconstruction aspect also. And that would bring a lot of benefits for the patients. It's not just doing the breast reconstruction. There are techniques in which if you do not have proper training for both areas, you cannot use them. These are techniques that have to be mastered. And the final result of the techniques also is not the best one if a person that is doing the oncological part and is not careful enough. And the same thing happens if the person that is doing the reconstruction part if they do not have a specific details, they're going to make it easier for the reconstruction to happen. So it's not just the benefit of doing both things. It's being able to do a lot more things than just with two teams, and very often. Our part of our students were breast surgeons, oncological surgeon, and plastic surgeons from many different countries that participated in the course, and it truly has achieved results. We have meta-analysis. This is a meta-analysis of level 2 of evidence showing the benefits of oncoplasty. Nowadays, it's already considered the the standard of care, actually, by NCSSM. So nowadays, oncoplasty, not for all of the patients, but the ones who need them, it makes a lot of difference. Dr. Veronica wanted to say something. There's a person sending a message that's probably in the wrong link. She's joining us in a few minutes. So oncoplasty has many different benefits. It reduces the compromised borders, improves the satisfaction, can allow people to remove bigger tumors with the improvement of the quality for the well-being or for the life of the patient. There are many different techniques. It's not just one. They're complex techniques, a lot of things that I have to learn, many different types of mammoplasty, superior pedicle, inferior, round block, wise pattern, vertical mammoplasty, geometrical compensation, many different flaps here, the glandular, dermoglandular, symmetrization also, lipografting as well, lipofilling, post-radiotherapy defects, the perforator flaps like cap, A cap, my cap, L tap, bilobe like cap, breast augmentation. So there are many different techniques of oncoplasty, and we cannot learn them all just by looking at 2 or 3 different surgeries or 2 or 3 modules in a course like this. We need a longer course with the details that are necessary. What we wanted is for people who took the part of this course to be safe to do these techniques for the patients and to offer the best care possible. Some students, they say they did the course of the, we want them to do the course and to know for sure and to know in detail and thoroughly the technique to use it appropriately. There are many different techniques of breast reconstruction. You have to understand expanders, implanters, implants, prepectoral, subpectoral, using mesh, lipofilling, latissimus dorsi, also tram flap, nipple and areola reconstruction, many different things. We know that there are different profiles of students. Some are more interested in the area of a partial reconstruction because there is someone with a plastic surgeon working with them. There are 3 different rooms that happen at the same time, simultaneous ones. So there will always be a partial or full reconstruction happening with mycutaneous flap, with breast reconstruction also. So there will be a lot of variety happening at the same time. And the student can select the room that they want to watch the surgery. And all of the surgeries are going to be also recorded. And some students, they didn't want to learn full reconstruction, and he focused on partial reconstruction or oncoplasty. But these techniques, it's not possible to do just one technique with these specific types of techniques because the patients, they show up little by little. And there are some cases, some techniques that have a very few cases over the course, and the patients come with, and you have to use a specific technique for them. There'll be a module on tram, which is the abdomen reconstruction. Some might not be interested, but at the same module, Many mammoplasties will happen at the same time, and we'll be approaching this technique. So the course is made so that at the end of the 11 months, you'll have to be able, you'll have a global view of breast reconstruction and mammoplasty. Just one module individually doesn't really bear fruits. You know, you cannot in a in a module, for example, with lipofilling, lipografting. There won't be a specific case of lipografting and lipofilling. There will be in other modules. They happen throughout the course. At the end, we'll have operated over 100 patients, so we'll have seen everything in details. There are many different types of courses. These are the courses that we have here in Brazil. We've already done a questionnaire with the mastologist and the breast surgeon. 60% of the patients, the mastologists that answered here, with over 3,000 mastologists answering, half of them did breast reconstruction, and they did everything. So most of them learned in courses like this one here. Like our course is the only one with this model with the online and hybrid course. This was one of the first ones that was created in the country. So a lot of the Brazilian mastologists, they took this course, and the ones that answered this questionnaire, almost 100% are doing mammoplasty and reconstruction with implants. 60% lipofilling, tram here 40%. So a lot of these students, they will feel safe to do it afterwards. It has a very, very big impact, this course here. This was a master's thesis that was, we mentored up to 2 years ago, 150 surgeons were trained in this course, 108 face-to-face and 50 virtual students. Now we almost have 200 surgeons that have been trained with us. And during this period, we did over 2,500 procedures. The same patient does many different procedures. On one side is doing the reconstruction with the implants, on the other one a mammoplasty. So the same patient is going through many different procedures at the same time. So at the end, it's not just 100 patients. On average, 2 patients does 2 or 3 procedures. And 70% of the procedures, the focus are the breast reconstruction. There was a very high rate of satisfaction, higher than 90% of the patients were satisfied with the course. Most of them that started the course didn't used to do any type of breast reconstruction before, and most of them could do breast reconstruction. Over 75% of the cases were done by the students themselves after the course. And all of the patients, the students that did the course, they recommended and 100% liked, and then they said that they would recommend. What the structure is like of this course. We started in 2015. After in 2022, it expanded to the digital world and virtual with simultaneous interpretation to English and Spanish at the same time. Each surgery is explained by many different experts from other countries and experts that are going to comment, and from people from Brazil as well. And some of them say, you know, in the UK we do it this way, in Hungary we do it in a different way. So we'll have colleagues from many different countries that will comment, and also they will talk about their own experience. On Thursdays, we have an activity for the in-person students, which is the post-op, to check the post-op of the patient. We send pictures of the post-op for all of you, the students, to know what happened afterwards. The in-person students, they can see the patient live, And on Thursday, we do a workshop of markings before the procedure. If you're in the virtual course and throughout the course you're interested in going to the in-person one and you want to see it in person, you won't be able to go into the field, but you can be outside the surgical field taking part in the in-person workshop that happens on Thursdays. But you'll be able to watch it remotely. On Fridays in the morning, we have the theoretical part. There are classes, many different classes on different topics. At the end of the 11 months, we'll have approached the main topics on breast reconstruction and mammoplasty and the most relevant aspects in the oncological part that are relevant for breast reconstruction. And we also have the case discussion. Some of the students, they send us cases that they operated on, and all of the students, midway in the course, they already start breast reconstruction in their own hospitals, in their clinics. And especially the virtual students, the remote students, have a similar understanding to the ones that are here in person. This is much more of a mentorship than a course itself, because everyone is interested in actually learning. So we're going to discuss the case in depth, and then we're going to check the results, the reason it didn't work, and with the complication that what we might have done differently. So this is on Thursday night. It's Friday afternoon. We do the 3 surgeries, and also in the Saturday morning and Saturday afternoon with 3 different simultaneous rooms. We show all of the surgeries and to make it more dynamic, so it doesn't get boring. So 3 things will be happening at the same time. Each professor draws the attention to a specific aspect of the surgery, and at the end, if the student wants it, they can fixate the screen of the Zoom in one surgery. For example, you're not interested in one specific room, such as 1 and 2, and then you can fixate or pin the room 3. And you can watch the other surgery, and you can also watch these surgeries later because they are recorded and they are they're left available for 1 year. And then you can watch the surgeries from beginning to end. You might prefer to watch one specific surgery from beginning to end, and then you can also do this after the recording is made available, after you finish that specific module. A large amount of reconstructive procedures, especially mammoplasty. Mammoplasty are definitely the most important one. All of the techniques, the pedicles, fat grafting as well, liposuction, and also the cutaneous and subcutaneous flaps. Also, they are very important because some patients they are irradiated, they need to solve some of the complications. It's bad to do a procedure and not to solve a problem or to find a solution for a complication, especially when there is an implant. If you do not know how to use a latissimus dorsi or a tram flap, you can do some procedures, of course, and your colleagues do other procedures. But the point is for you to have the opportunity to learn everything during the course. So we've already talked about the models, the types, and these are the students. On average, we had students from over 10 countries. There were 2 other countries that joined us last year. It was Europe, the US, Asia, many different countries from Latin America. Most of them are breast surgeons. We had plastic surgeons, oncologic surgeons also. This is an interesting information. Most of them didn't know anything in terms of level 2, 3, and 4. The level 2 is the mammoplasty, level 3 is the local flaps, and level for the reconstruction with the myocutaneous flaps. This is the classification of Cicero. At the end, most 80% of the in-person students and 70% of them were carrying out the surgeries really safely, and 70 to 90% were also doing the reconstruction with an implant and an expander. And the interesting here, this is a significant, statistically significantly aspect. The people that watched remotely, they had more certainty than the people that did it face to face. And it's interesting because these are the frequent surgeries that happen less frequently, and then you can rewatch the surgeries, all of them, not just the one that happened in a specific room, because there might be a latissimus dorsi in one room, and in the other room there might be another surgery that is a different one. So in the virtual one, you can watch all of the three ones. There are some advantages to it as well. We had almost 0% of people that need to refer to other doctors. You know, people who did the surgery, they were really the doctors were really safe, and they managed to solve all of the complications. That's something really interesting. There is a room. We have a camera that is on the roof. It's the one with a giraffe tripod, and also the moving camera that shows the details. And there are many different commentators from different countries. Dr. Benito is here, and also the graduation. In the last module, number 11, we asked people if to see, even the people online, if they want to come in person, they should. We're very welcome. We have a very nice structure. We do a graduation ceremony, a handing out the diploma surgeries. Of course, you can get the diploma via mail as well. But it's really nice to be able to, after 11 months, to celebrate this victory, because it's a true victory after 11 months. We have some videos promoting the oncoplasty.com. It's a free website. That's what I wanted to show you how it works. And I'd like also Sergio. Sergio is from the technical team. I'll stop sharing the screen now. Is it working? Yes. Okay, now I'll show the videos. Sergio is going to show the structure of the course and the recording. Zoom is a special Zoom that has a higher quality and many different recordings. There is the original language that is spoken, and also the recording in English, recording in Spanish, and just in Portuguese. So we have the original one, and each one that is individual in each one of the rooms. I just want to show you some of the surgeries. So you'll be watching in details what's happening. We'll show you. This is a recording from the individual room. It's not a recording from the Zoom. Can you have a recording from, do you have a recording from the Zoom session to show us? Yes, I'll show it now. How are you going to see most of the procedures, right? I have all of the markings. These are classes, theoretical classes. As you can hear, there are many doctors speaking after they changed the video, and the professor explains some, they focus on, they zoom in specific details. There is the marking as well that is fundamental for a planning. And the idea is for, at the end of the surgery, for you to be very certain or to sure of the planning. You can see many different details of in this case here is the tattoo of the nipple areola complex in 3D. So I just wanted to show these are some of the flashes, and they have a very professional quality, the recording. Each one of the step-by-step in each one of the surgeries. And there are some people that make comments, the debaters, they ask and they say if they would do in a different way. This is a 3D tattoo, so they have an opportunity to learn a lot of things. I think that was an overview, right? Just a little bit of each one of the surgeries, so you know how it works. In reality, it is a very complete, very thorough course. There are many different procedures, and people who have graduated the course, they understand the techniques really well. We talked individually with each one of the participants. The colleagues these colleagues sent us cases, both the virtual and the in-person students. They were doing the reconstruction techniques. This is what I wanted to show you. So maybe Dr. Luis Fernando would like to make any comments. And I'd like for you to introduce yourselves if you want to say something, what you do, what you want to learn in the course, because this is a course that in which we can individualize the teaching experience. It's not a very very large number of students. It's a more restricted number, so we can have the possibility to talk, discuss, and also to talk about any needs that the students might have. Good evening. Good evening, everyone. I'd like to emphasize that the course, considering everything that had just mentioned, during the surgeries, you can also ask us to send or to focus on a specific detail. And especially on Friday, you can present some of your cases or discuss a case that you thought it was interesting, or you can also ask about something that you didn't understand really well. And it's a very interactive course, and we can meet a lot of the demands and the needs that you have. And of course, we're not going to go over all of the existing surgeries, but considering 100 surgeries, and some of them we do 2 or 3 procedures, we'll have a very good sample of 200 and 250 procedures that will be made. Most patients that do bilateral procedures, and the procedure is not always the same on both breasts. On one might be one technique, on the other one a different technique. That's why we have an opportunity to do a lot of procedures. We're always open to discussions. And it's important for us to try and include all of the specificities of breast surgery as we can. Good. Now, what about you? Would you like to ask any questions? Are there any questions about the course? Administrative questions or if you want to introduce yourselves to the other colleagues to speak about what you already do, you can do it in your own languages. There will be simultaneous interpretation to the other languages. Hi. Ladies first. I'm Laura. I'm an oncologic surgeon from Chile. Sorry, I do not speak Portuguese. I'll speak more slowly. My point, especially considering that I'm away from Brazil, it's hard to be able to go there in person. If I have the virtual option, I might go to any other module in person. Can I go? Can you hear the simultaneous interpretation? There is Spanish simultaneous interpretation. And you can choose to hear it in Spanish, right? To listen to it in Spanish, right? All the course has simultaneous interpretation in English and Spanish, besides Portuguese. Okay, I'll speak in Portuguese. Can you hear me in Spanish? Can you hear me in Spanish? Yes, perfect. It works. Now I can hear it. So that is an advantage of the course. You'll have the simultaneous interpretation in your own languages. We'll be speaking Portuguese or English, and there will be the interpretation for the other languages, such as Spanish, and there will be 3 languages being spoken at the same time. Some of the colleagues that speak English, and there'll be interpretation to Portuguese and Spanish, so everyone will listen to in their own languages. Now answering your question. First of all, nice meeting you. We're very happy that you're interested. I hope the course meets your expectations. Yes, it is possible. If you want to come here in person in some of the modules, it is perfectly possible. You can select, for example, this module and the other module. Maybe it's a topic that you might be very interested in, and maybe you might want to see the marking in person of the surgeries, and you might try and do it in person because you might have a specific difficulty. You can always do it in person. And in the last module, we encourage people to come because we have a special infrastructure for this. We have a graduation ceremony. There is a very big screen that we put up. So we can be together at least in this module. So if you want to come to different modules in person, of course, you can. There are 12 in-person students. In each surgery, 4 students are allowed in, and the students themselves are the one operating. So there will be 2 on one side on the surgical table and 2 on the other side. If for more people to come in person, it would be too much. You can come into the room, but you cannot be in the surgical field. And there will be monitors for you to watch if you think that you can watch better in the monitors within the surgical field. One fun fact. A lot of colleagues that I only met in the 11th module, the last one, they wanted to come in person, they made sure to be here, but almost all of them, they were not in the room. They were actually watching on the screen because you can actually see the surgery better from the screen than in person in the surgical field. That is a fun fact about this. And we said, oh, you came from afar to watch the surgery, but actually they prefer to watch from the screens because you can see it. There is the zoom that you zoom in, and you have a view exactly like the surgeon. Not always the person next to the surgical table, they can have the same view, the same perspective. Thank you. We have some other hands raised here. Veronica. Sorry, Veronica, for sending you to another link. I was in the wrong link as well. Veronica? No problem. What a pleasure to greet you and be here in contact with you. Well, doctor, you always heard of the interest that I had of taking this course, and for one reason or another, I couldn't do it before. I wanted to say that I want to share the opportunity, share this opportunity to some of my colleagues, and I would like to ask some of the questions that came up. I talked to them. I mentioned to them the quality of the course and how good it was. It's a very thorough course in oncoplastic surgery. One of the aspects that they asked me is the cost. Because if there is a different price for the virtual course and the in-person ones, I am from Nicaragua. If my colleagues are from Nicaragua, it's not possible for me to go there every month to Brazil. So in reality, the only way for us to do it is virtually, to have the opportunity to to do the course. So they were asking whether the price is the same for the in-person or the virtual one. And the second question is whether we can choose the modules that are more interesting and not the whole course. Well, Veronica, it's a pleasure having you here. Veronica is a very important mastologist from Nicaragua in Latin America. She was also giving a course on oncoplastic surgeries. We're very happy to have you here. The in-person and the virtual courses, they're different, the price, the value, the amount. The in-person students, they pay 7,000 reais a month, which is around $1,500 a month for the in-person. Besides that, you have this help, the the air tickets and the hotels also. The virtual course is around $1,000 per student. You can come here in a specific month, but you'll keep paying for the $1,000 because the people who are in the in-person course, they'll be in the going to the surgical field. It's different. So it's a smaller cost. We know that this cost is a bit higher than some of the other courses that are available in the market, especially in Latin America, but there are different types of courses. You cannot compare a course that on one class you'll see one or two, three surgeries with so many people, you're going to watch it in a screen. Pretty often you're not able to take part in the surgery. It's another person's operating and you just watch and you'll see one, two, or three surgeries. And you won't have the opportunity to do a proper training. You cannot learn in three surgeries how to do breast reconstruction. There are many different techniques. It's something complex. And we believe that most patients deserve something of very high quality. We cannot offer the patients that is second rate or second quality. We want the person to take the people who's taking the course to offer the same technique as any reference center in the world. There will be no difference for one person that is operating in this course here and another one in a very famous hospital, such as Memorial Hospital, to have a different quality. We want people that at the end of the course to have the ability to have the global view of the perspective of the oncoplasty. The problem of doing one or two modules is the following. For example, if you do a tram model, this is just an example. It might be any other technique other than tram. The person, rather than just doing the tram, if the person does a tram course, during the month of the tram technique, there might be no tram surgery. That cannot be predicted because the patients, they come little by little. We do not have lines. They do not wait 6 months or a year to do the surgeries and to have the surgeries just in the month that they explain the theoretical part of the tram or the specific technique. Every month there will be mammoplasty, reconstructions with implants, and other techniques that are going to be happening month by month. Depending on the month, there will be LICAP, there will be geometric compensation, or MICAP, or an LTAP. There will be one or two cases. It won't happen every month. So you might do a specific module of a specific flap, especially local flaps, for example. In that specific time that I taught the class in that month, there might be no case, and in the following month, there will be 3 or 4 cases in that technique. So we cannot predict which techniques are going to happen according to the surgeries that happen. So it's important for students to take the whole course, because if they want to learn how to do the local flap, in the first month, for example, there might be a geometric compensation. Next week, there is a geometric compensation that is going to happen. In the next week, there will be a light cap, and then the bilobed. At the end of the 11th month, the person will have had the opportunity of watching all of the techniques to learn the step-by-step each one of the techniques, seen 2 or 3 times, and feeling safe to do the technique and to do it with quality. I do not believe that you can watch one complex technique like this once, and then you'll be able to reproduce the technique. Maybe a person that is highly skilled, okay, but most people do one module here and many different courses throughout many years, and at the end of the course, they are not safe to offer all of the techniques, to do all of the techniques. If you want to do mammoplasty, you use and each one of the techniques. Latissimus dorsi, subpectoral. We want the students to finish the course and to be ready to have all of the necessary tools to offer what is necessary for the patient, not to what is pleasant for the patient, to say, oh, I just want to do the prepectoral, and then you do the prepectoral. Maybe you might have the patient that might come up and will need a different technique, such as the myocutaneous flap. So we want the person to have understood all of the techniques and understood the students to understand step by step of each one of the techniques. So at the end, this patient will decide which technique they'll use. And for example, for a specific patient, now I cannot do here prepectoral. I cannot do a mammoplasty. I have to do a myocutaneous flap. And if the person doesn't want to do it, they'll be able to recommend, and they'll be able to do with safety the technique. Not just do what they learned. For example, I only learn inferior pedicle, mammoplasty. For some patients, this technique might not be the appropriate one. It's important for you to have an overview, all of the techniques you have to understand. So it's a different objective for this course. This course is very different. At the end, it's a different situation. It's not the same as 10 different courses, because you probably won't be able to see all of the cases that you see here with us. It's unique in this aspect. Okay, doctor, thank you very much for the information. And the last question that I have is considering the certificates. The certificate is given by the Hospital of Cancer. There is a specific certificate with the class hours, the schedules, and all of the subjects that were approached. And some of the students, they needed further details. For example, there was an American doctor that was not certified to do reconstructions with implant or expander. So she asked us for a report detailing how many surgeries with reconstruction happen throughout the course. And now she's getting certified, and she'll be able to do the reconstructions with implants in the hospital where she works in the U.S. We have different demands according to each one of the countries. And of course, we're going to try and meet the demands of each one of you to facilitate your certification or accreditation. Okay, thank you, doctor. You're welcome. Luiz, you were saying something? You wanted to make a comment? I just wanted to talk about what she mentioned about doing the one module, just one module here. The problem is that the patients that we have, they have a cancer, as advanced cancer, so we cannot choose a specific one, because that is the normal flow of the patients that come to the hospital, and we cannot wait. We just operate on the patients that come. We use the techniques for the patients that need it, because a lot of them already have a cancer. with the exception of the mycutaneous flap that have late reconstruction. We do a lot more late reconstruction than an immediate one in mycutaneous flap, and the rest are the patients that are there. They have cancer, and we have to treat and the cancer using the technique during the resection of the cancer, the tumor. They're asking about the dates, right? The calendars of the classes. We have all of the dates here on the website. Can you get the dates, Kenny, to copy and paste here on the chat? On the website, we have all of the dates of the whole year, so you can prepare. And maybe in specific dates, you might have a conference, and you'll be able to watch the recording of the meeting. And each individual one, from beginning to end, individual surgery, actually. There is a problem with time zones, for example. Some colleagues from Indonesia and other places that have a very big time difference. It's already on the chat, Dr. Regis. Great. And maybe it's too late to watch one part of the course, and they can watch it later. The recording will be available for you to watch it. Let me see who else is here. Dr. Breno, Sebastian from Cordoba. Do you want to ask any questions? Hi, good evening. I'm Sebastian Irico from Cordoba, Argentina. I'm already registered in the course. I have already registered. I had very good references or recommendations from you, as with Dr. Luis Fernando as well. There are two colleagues from the hospital where I work that went to the course in person, and the recommendations were great. We work a lot in mastology. We do oncoplasty reconstruction, and I believe this course would help continuous understand and learning in the different techniques for me and for my team. As you mentioned previously, the amount of surgeries, everything that is related to it, both the presentation and the markings as well, and the explanation. And that's why I'd like to do it in virtual form, because they said that it's probably even better in the virtual way than in person. They said that we can also travel to do it in person, to go there to understand the structure of the course, what is within, especially the operating room. But I'd rather do it, the virtual course, completely. Yes, I believe it's going to be very fruitful, and we're happy that you have already registered for it. Some colleagues are very experienced. There is a colleague that is a plastic surgeon from Colombia. She did the plastic surgery with Pitangui, Dr. Pitangui. She did the reconstruction in Colombia. She took the course, and she was really in awe. She really loved learning a lot of different things that she hadn't to learn before, that she didn't do. Back then, she didn't know some of the techniques, and she learned some of the techniques that she had the opportunity to watch. she didn't have many opportunities to do the LICAP and the local flaps, especially and the plastic surgeons as well. That's some of them that did not have the opportunity to do it. People who that are starting, they have a great opportunity to learn, and people that are already experienced, they're going to learn even further because they're going to see with a lot of the details, and they can understand certain subtleties of the surgery that might go unnoticed if you do not pay attention to it. And welcome whenever you want to come here in person. You're very welcome. Who else would like to make any comments or ask questions? Reno Kuntz would like to make any comments, ask any questions. Dr.
Hi, my name is Kai. I'm from United States, and very thank you, Dr. Regis, Dr. Luis, for this great course. I think you convinced me to do the whole course because I initially was thinking about just doing module 1, but I think with only one module, you can only watch very limited cases. With this very, like 100 or 200 cases, that would be very helpful for us. And I'm already doing level 1 and level 2 oncoplastic cases, but I don't do a lot of them. I think with watching your videos and also watching that techniques will be very helpful for me. Thank you. Appreciate it.
Yes, I think you will enjoy because if you see more cases, the whole course you learn much more than just seeing 1 or 2 modules, for sure.
Gabriela said that she was really anxious to take this course. Great. Isabella, actually, right? Isabella from Curitiba. Yes, great. We had some colleagues from Curitiba that came over here the last month. Some were doing in person, some were doing the virtual one. And there was a colleague from Curitiba that came in the last module, and she said that she had just scheduled the tram. She and another colleague that had done the course virtually were going to do the tram, which is the most complex surgery. Veronica said here, she asked the following, whether you make space payments or you pay in all. You can do the in-person monthly payments, or else it's a very big amount of money. You can pay the course monthly using your credit card, 11 months, right? 11 payments, a credit card or transfer, the way you prefer. Usually, most people pay monthly, right? It's easier to pay like this. So there are no further comments on the chat or questions. Would you like to say Breno? Breno used to be our student, the in-person one. I did the in-person one 4 years ago, and everyone says that whenever you take the course, they have very positive comments. And the mastectomies they have reduced a lot. We got excellent results. I'm doing it as a recycling, or as I love the topic, and I'd like to see some things that I haven't seen before, and I'd like to remember it's not possible to do in person because we eat a lot of cheese when you go there. For the students that are not from Brazil, the state of Goiás is famous for its cheese, and it's 24 hours to get here, right, in Goiânia, right? So the hardest part, it was harder to come from place where he was than from abroad. So if you do the in-person course, oh, it's a pleasure. And if you do the we loved eating cheese, right? Goiânia queijo is amazing. And if you do the in-person course, still believe it, you're gonna be 12 friends because there is a lot of conversation and exchange, and it's you. I'm repeating here. I'm doing the course again because I want to remember some of the techniques and also that I didn't use and to learn anything new that came up over the past 4 years. And we actually made 12 friends. We're friends until now. We have a WhatsApp group. We in every national conference we come together. It was very important, very nice, an amazing experience. Thank you. Great. I think that's it, right? Are there any other questions or comments? Anything, everything was clear. We just wanted to show you some of what we see here in the course. In a course like ours, people look and they see there are courses that are not so expensive, they're cheaper, but they don't have the amount of procedures, the complexity that you learn here in a course like ours. So there is a very small amount of procedures that you do here in these two other courses, actually. I'm sure that taking this course, you'll be able to understand a lot more. You'll be ahead of the rest of the colleagues that do different courses that do the breast reconstruction. You have a much broader view. I don't know if everyone has an Instagram here, but I put on the chat on Instagram the testimonies that happened from 2022 to 24. I believe you already shown, right? Lourdes, Baez, would you like to comment something? Who else is there? You want to introduce yourself? Good evening. How are you doing? This is from, I'm in Itaúa, Paraguay. I did a lot of courses here in Paraguay with they have already taught me a lot. I always check the page. And my limitation is traveling all the way there. But now I'm ready for the virtual module to get more experience. My purpose is to keep learning. It'll be a pleasure having you here with us. When the course finalizes on March 2027, it's still available until March 2028. So it's available after the course is finalized, right? It's a very large amount of hours because besides the course that is over 200 hours, you'll have the online course that is going to see in each one of the rooms, you'll have the individual recordings of each one of the rooms. So there are 9 recordings. It's like multiplying the number of hours by 3 hours. So you need enough time if you have the time to watch the recordings, they're very important. And these are one of the factors, and that's why the online courses, the virtual students, they felt more certain to do specific surgeries because they could repeat the surgeries and watch them again as opposed to the in-person students here. Each module is 21 files, doctor. It's a lot of information, right? It's a lot of recording for you to follow afterwards. And then you can select what is more interesting for you. There's a lot of material study for all of you. Isabella, Catalini, if you want to make any comments, would you like to?
Yeah, hi.
Heloísa was a student of mine in the course in Belo Horizonte, right, 2 years ago. We're happy to have you here. Dr. Renu Kuntz, where are you from? Dr. Kuntz. Where are you from? Dr. Renu Kuntz? Maybe he cannot hear us. I'm very happy and excited. It'll be a pleasure. If you want to come here in person in any of the months, feel free to do this. Very excited with the opportunity. I took a course with you in 2012. I always wanted to do this, and I reflected about the possibility of doing the in-person course. I really wanted to do the in-person course, but after doing talking to you, I decided to do the online course because we might have so many activities, such as conference, that it's hard to to have activities, the in-person activities for a whole year. So the online, it's a very good variety. It's great. It'll be really interesting. All right then. So I think we can finalize the meeting. Dr. Hedges, they're asking about the possibility of download and watching in their. I think it's not possible, especially because of the safety of the patients, but they can access the platform at any time they want to access. There is also compliance, right? Because we have the privacy of the data, the patient data. That's something else that I'd like for you to do, to be careful with. Do not take pictures of the patients and the surgeries themselves, because the patient might have a specific tattoo and that might identify the patient, and the patient might feel offended. We know that these pictures might go viral on the internet, and we have to prevent this from happening. And the patient might see this and they might feel offended. It'll be available just on a platform for the students that will be able to watch as many times as necessary during this 1 year of course. And you'll be able to watch it anytime. Afterwards, it's going to be erased because the storage is very large and the quality is very high, and it's very expensive also, the storage. That's something that makes the course a bit expensive. So after 1 year, the information is erased, and then we're going to have enough space. Catarina opened her mic, but she didn't say anything. You want to say something, Catalina?
Hello, can you see me? Yes, okay. I'm a gynecologist from Austria. And I'm really looking forward to this course. We do a lot of mammoplasties. We do flaps, local flaps, and I do reconstruction with endoscopic mastectomy. But you have a lot of themes that really interest me. And I think I have a lot to learn from you, and I'm really looking forward.
It will be a pleasure. And we will have plenty of opportunity to discuss the cases. You can send your cases. Maybe you have an idea for planning for a case, and me and other professor have a different planning, and everything is very, it's beautiful because you construct together the knowledge. It's important. You can change ideas. It's very rich.
It's really great. One question: I really want to do all the 11 modules. At some point, I looked at the dates. It may be possible that I'm somewhere else or I'm on vacation and I'm really not gonna be with my family and look on the internet. regarding the modules, do we get some certificate of the modules?
No, there is a final certificate. After the 11 months, there is a certificate with the whole course, all the hours of learning, all the program, and a complete certificate at the end of the course.
Okay, that's great. That's what I wanted to show, and okay. And I hope we also get the receipts because I have to show them to my accountant afterward. Okay. Well, thank you.
Auf
It's
Wiedersehen.
great. Danke, auf
freue
Wiedersehen.
mich.
Gute Nacht. It's almost 2 o'clock here in the morning, but I'm very happy to do this.
Dankeschön für sein hier mit uns.
Okay, dann sage ich dann gute Nacht.
Gute Nacht.
Okay. Okay, thank you. Bye-bye.
Danke. Érico Rueda, queria se apresentar.
Érico Rueda, would like to introduce yourself. Gilberto, you've already been our student, right, Gilberto? You're going to take the course. Gilberto is from Colombia, right? Hi, Regis. How are you doing? Nice meeting you. Again, I was in a surgery and I just finished it. It'll be great to be here with Luis Fernando, sharing these moments with you. And we learn a lot in this course here. Even though I graduated when the tram and the latissimus dorsi were the gold standard, right? But it's changed a lot over the years. I learned a lot with you, and I applied all of the techniques, or most of the techniques that I learned in this course, on our daily practice every day. You can apply the knowledge that we acquired with you and this course. And I'm really excited to repeat it because every surgery is a new case. And in each surgery, we learn something. So I'm very excited to participate in this course once again in this format. And I believe that we were the first group in the remote time without any simultaneous interpretation, but that didn't stop us that didn't prevent us from participating and taking part. It is going to be a pleasure for us to be together here. Thank you so much. You're welcome. Anyone else?
Is this name is from maybe also German. Israel, welcome. I hope you'll be with us, Kelita. Do you want to present yourself? If you want, please, you can open your camera and your microphone, and you can talk and we can discuss anything you want to know. Eric Rueda, Andy já conosco também, foi nosso aluno, Andy Pantoja.
Andy was here as well, right? It'll be a pleasure to be here with us.
Kelita é intérprete, desculpa.
Sorry, Kelita, yes, got confused. I'm not good with names. I thought you were a student, all right? Thank you for the interpretation you provided to us. All right, then. So I think we can finalize it now. Luis, would you like to say something else? I would like just to tell you that it's a pleasure to be here with you. And for us to learn together. We're going to learn definitely together.
Vamos em contato também com a Kênia, né? Com a equipe técnica, elas são sempre bem solícitas ali para ajudar.
With technical team also that is going to learn. I think there is a mic open here. So Kenya can help you with whatever you need. You can send her a message. If there is any difficulty in the administrative part, you can talk to her. We're always available. And Clara as well. She has her cell phone talking to them, practicing English and Spanish. Great. Thank you. Good night to everyone. It was a pleasure being here with you tonight. And hopefully we'll be together next week. Good night, everyone. See you next week.
Boa noite, gente.
Boa noite.